I'm here with Anita Moore at Remote Area Medical. It's a traveling free medical clinic, and this time around they're stopping in Oakland. We're at the Oakland Coliseum. Anita, I understand this is your second day.
Yes.
What have you done in the past 2 days?
Okay, the past 2 days I did vision, I did acupuncture, I did getting my teeth clean, getting 4 extractions, and getting 2 filled.
Wow.
Today I'm here because I was just picking up my glasses. And I tell you, this is a fantastic program. Everybody that I came in contact with treated me as if I was an individual person. You would think we were paying them to do this. Their attitudes were it was just remarkable how with all the people that they have dealt with, they still have positive attitudes, and most of them are enjoying everything they're doing. I've just heard so many people saying thank you, and they're just overwhelmed. And Pam, she's just remarkable. I wanted to know who put this together. I met her. She is so modest. She is really modest, and this is not a light thing, to get this many people to come out. And it's free. It's just remarkable. Just remarkable. And the people in dental oh my God.
Were you surprised?
I was totally shocked. When I got home, I just told everybody. How you hear things and you say, oh, okay. I wanted to come check it out. The first morning I came, I was here at 3:30. And
3:30 a.m.
3:30 a.m. And I didn't leave here until 20 minutes to 6. But I was not tired. I was not frustrated. It was worth everything. Everything just went together. They took time, patience with you, and everything. I couldn't move my left arm yesterday. I couldn't lift it past here. Now I can lift it up. I did acupuncture.
Wow.
I was just in shock.
What's wrong with your arm?
It was just, they told me I had inflamed rotor cuff. So it's been stiff for like 6 months.
6 months? You haven't been able to lift it?
Because I lost my medical personally, I haven't had a chance to go through therapy to get it done. So I said, I'm just going to try the acupuncture. And I told him what was going on. He put 2 pins here, 2 pins here, and I was saying, okay. Because he asked me, had I ever did acupuncture before? I told him, yes. And I tell you, I wasn't even in there 15 minutes, and he had me moving my arm around slowly. I was moving it slowly. And then he said, how it feels? I said, it feels pretty loose. And then I stretched it out. I started doing like this, and then I started doing like this. And I've been doing it ever since, and I'm just so happy because, I couldn't lift.
So 6 months and you couldn't lift your arm?
No, this is as far as I can move it. And yesterday, I came home and I was doing like this, and Mom, that's your bad arm. Not today it is. I was just shocked.
Incredible.
And this was less than 15 minutes of acupuncture.
See, isn't that amazing, the power of acupuncture?
It is. It really is. I've done everything in this building except for chiropractor. I didn't go there. But I did everything in this building. I tell you, everybody is just... And in the morning, they have us doing exercises. It's so fun when you come down the ramp. You forget that you're actually standing there waiting. They have you doing exercises and singing, and oh my goodness.
Wow.
It's just...
So you don't have health insurance right now?
No, I don't.
Are you working?
Actually, I'm a workman's comp. I'm an ex-postal worker.
Oh, okay.
I got in that rift.
Yeah.
And so...
Oh, wow, that's probably why you've got arm problems.
Yeah. And they dropped my medical. And so I haven't been able to get... And I've been trying to get on the phone every day to see what's going on. They've taken it out of my workman's comp in some kind of way where your job drops you. The workman's comp's supposed to pick you up, so I've been without medical.
But you're a former government employee.
Yes.
And you're without medical.
Without medical. Isn't that sad? But I'm on workman's comp, but they're taking my money out of my workman's comp for medical, but I don't have it. But it's just good that this came right on time. It's a blessing.
Yeah.
I'm sure I haven't heard anybody say anything negative about this at all. They want to know when they're coming back.
Well, that was my next question for you. How are you going to stay well and be able to move your arm? Because clearly acupuncture, you need it regularly.
Yeah. He told me just keep exercising it and don't drink cold things. Drink warm things or room temperature. Because he said when your muscles are tense like that, he said it makes you cramp up and get stiff. So I'm trying that.
And where do you live?
I I live in Oakland.
Okay, because I'm sure there's community acupuncture there where it's not.
You know, only one I
too
heard of is
expensive.
one in San Francisco. My daughter was telling me about. I said, but what time I travel over there?
Yeah,
and it's free.
I'll get your email. I bet there's community acupuncture in Oakland.
Really?
I'm sure there has to be.
Okay.
Yeah,
Because I don't know about it. And I'm telling you, word of mouth is just amazing.
well, because this didn't
I
get
heard
much.
about this from my daughter in San Francisco. Got the information, and she told me, and then here I came, and I told him.
They said they couldn't get much media attention before to let the people know they were even coming.
But I tell you, word of mouth.
Word of mouth, yeah. Wow.
Yeah.
So, wow, that's incredible to
And
hear
there's
your
going to be
story.
a lot of people that wish they had a cane.
Right.
Wish they had a cane. Because, look at the dental. The dental was that's the hottest thing, the dental. The dental and the vision, that's the hottest things. And for that many...
Are those the glasses? Those are the glasses you picked up today?
No, actually, these are not, but they have name-brand glasses. They sure do. They have name-brand. In fact, they had these are coffee beans. They have those over there.
Yeah. I mean, and Anita, we're talking about basic care so you can function in this society. What message would you send to the people who make the decisions about healthcare in this country?
You know what? If they can put their selves and just think of, what if I went down the ladder? What resources would I have? Because me being a postal worker, I wouldn't think that I would be in this situation. But I always support stuff like this because you never know. I'm in food lines now. I go to food lines. Matter of fact, I'm going to food line tomorrow, Tuesday. That's my day, Tuesday.
How long did you work for the Postal Service?
12 years. 12 years. So, I wish they would reconsider. Sometimes when you're at the top, you've never been at the bottom. If you be at the bottom and come up, you can understand the people. Oh, this is her coffee.
Yeah, is it cranberry juice or pomegranate juice?
You can have it.
No, they were asking about it.
Oh, yes. Okay. Thank you. Well, Anita, thank you so much for your time.
Oh, you're welcome.
Anita Moore, she is here at the remote area medical at the Oakland Coliseum, and as you can see, she can raise her arm for the first time in 6 months, thanks to acupuncture.
That's right. Because, I couldn't lift my arm past here. Yesterday, after that, I can raise it. And it hasn't stiffened up on me either. And I'm going to give her my email because she said it's probably something in Oakland that are doing free acupuncture.
Or at least discounted, but I bet we can find somebody. Yeah.
Yeah.
Thank you so much, Anita.
Yes,
Thank you.
I appreciate that.